to another episode of Your Faith in Health Community. I'm your host, Pastor Jackie Jackson, and as always, on behalf of myself, as well as our producer, Anita Alexander, we want to thank you so much for taking time out of your busy day to spend with us. Hopefully, prayerfully, we'll give you some information that will improve your quality of life. I want to jump in on something real fast because time is running out. I want you to know that open enrollment for Medicare, not Medicaid, but for Medicare, ends December 7th. We have Marjorie Mosley from HRS Erase Navigators that's here today. We're going to talk about it. You've seen her before. She's going to give you some important information. So, Marjorie.
Hi.
Marjorie Mosley. It's good to have you back here again. Always happy to see you. Always happy to have you come on because you definitely bring information for people. And I know today you've got some information. So we're in the middle of, not the middle, in fact, it just started, November 1st?
Yes.
Open enrollment. And I said for the Marketplace or Obamacare, what exactly is it?
It's the Affordable Care Act, and it's the open enrollment period. And it runs from November the 1st through December the 15th.
And so now this isn't necessarily in conjunction with someone, if your workplace is offering insurance. This is not in connected to that. This is for people who are going to the marketplace, searching for insurance on their own, not as a part of work.
Right.
Or is it still, and I know at one point you could get a level of subsidy or something from your job?
It all depends on what your employer offers. Like I have a couple whose employer just canceled their health insurance. So we are going to enroll them into the marketplace. Once the employer decides that they're able to resubmit for health insurance, the employees can go back to health insurance. But for now, those folks are in need of health insurance, so we are enrolling them in the Affordable Health Care Act. And that will begin effectively this January 1st, of 2021.
So you go to the marketplace now, or you get with HRS Erase, you get with a navigator.
Yes.
And you sit down, or you do it yourself, right?
Yes.
Or you call in and they have, is it still?
Healthcare.gov.
Healthcare.gov. Different languages, so there, if you feel like I have a language barrier, listen, they have somebody there that probably will speak your language. So you go in, you do your shopping, so to speak, you look at the plans, you decide on whichever one you're taking, you make your payment by January 1st, and then it's effective. Mm-hmm. But you got to make your payment before January 1st.
Or by January 1st.
Or by January 1st. So I call you up, we sit down. What am I going to be looking at when we go into the marketplace?
What I do when I help someone with healthcare, the first thing I do is look at plans with them and kind to proactively look at what they need, what they can afford, what it says their subsidy will be. It is only an estimate, but it gives them an idea of what particular plan works best for them and what works best for their family.
And so I know at one point there were the levels, and we talked about this the last time you were here. I know there's still platinum, right? And
there is the base. There is
so
silver.
Can you do this for me?
Yes.
As you mentioned each level, can you just give a little description of what those levels are?
So the base is just a basic insurance. It's going to probably cost you less, but your out-of-pocket expenditures are going to be greater. As you go to a bronze plan, it's going to be less, but it may meet the needs that you have. You may not go to the doctor often. So it's no big deal if your primary is $50 and your specialist is $150 because you're not sick, but that cost to you is not that expensive. But at the other end of it, your premium out of pocket is low.
So basically, the less you pay, the higher your copay.
It could be.
And the higher your deductible.
Yes.
Now, the deductible is definitely going to be higher, right?
Yes.
The copay may not.
So what I've seen, let me tell you what I've seen because I've been enrolling people. I'm going to gear you into a higher end bronze or maybe a silver based upon your needs. And what we normally look at, or what I ask people, is what can you afford in a copay? People will give me a range, and then we look for that, and then they'll say, that works. So I just enrolled a family of 4 in the marketplace. Their total insurance premium was less than the insurance that they were paying in 2020.
And that, so
So
that's
they
for
were
the whole
paying
family.
almost over $500 a month for insurance. I got it down to less than $500
For the whole family,
for a family of 4.
a family of 4.
And their specialist was, I believe, $90. Their primary was $30, $30 to $35, and their prescription was 28 generics. But I also got him to sign up for GoodRx.
Okay.
Yeah, so just in case, you got to have all these systems in place. He said, I need glasses, but you know what? I'll take the dental for myself and my family and not have the eye because, and I said, had you ever heard of America Best? He's like, oh yeah, they're opening up one near where I live at. I said, prescription and your doctor visit, probably less than $75. He said, I can afford that. So we do a little bit more. I know I do. And listening to what people need. And so I can offer them things that I know that I have utilized. I've utilized GoodRx. I went to the doctor, had a problem. I thought I had a wart on my foot. It was a callus embedded. And she said, oh, I'm going to give you a prescription, right? I didn't think to ask her if it was going to be expensive or not. She gave me a prescription. My foot's going to feel better. I get to the pharmacist, they say, oh, it's $200. Really, it was $199.99. That's $200, right. So, and she said, oh, your insurance doesn't pay for this. I was like, you got to be kidding me. I said, oh, I have GoodRx. She said, let me try it. She did. It came back. It was less than $20.
So good, and I've seen the commercials, and I think we've all seen the GoodRx commercials, but commercials on television, just because it's on television, doesn't mean it's good, right? And so I've seen those commercials, and I've wondered, and I'm not on any medication right now, which is amazing that I'm not, right? But I often wonder, like, yeah, they're talking about how good it is. You get there, and it's going to go, yeah, but it doesn't work for you. And so you're saying that, yeah, you've used it, and that is something good. And I think we're in that age where we've got to learn to learn to use things in concert. One size fits all is great, but one size fits all doesn't usually.
And how it works is like this. So they will try with your prescription subsidy, and they may say, we might be able to get it less for you if it's offered in GoodRx. But you've got to have that for them to even look.
Right.
So it doesn't cost you anything. There is a Gold GoodRx, which is $3 a month or something like that. But for the one that's free, you have nothing to lose.
And if you can afford $3 a month, if it's possible, and for everybody, like sometimes we think it's $3, how difficult that is.
It could be.
But for some people that could be difficult. But if you're in a position where you can, then it definitely gives you more.
I'm so glad that they're there. I don't know who they are, but thank God they were there.
They're GoodRx. So let me ask you a question, and I want to put myself. I just want to kind of put myself in a scenario. People have heard us say it back and forth before because you've been on the show a few times that when we worked together, we were work husband and wife. So
Right.
And we were very close friends. So
Right.
when I went through something medical, you knew,
Right.
Given my situation, had a heart attack, had that little strokey thing, had congestive heart failure, not on any medication. So obviously that's to God be the glory. But given what is potentially there, and I know that as a navigator, it's not your job to tell anybody what to get. At the end of the day, it's my decision.
Right.
But if you are looking, do you gear me more toward something like the premium or more silver?
I direct you to what you tell me. I give you the options, what it is. I go and read what the subsidy is for that particular product we're looking at. And then I go and see what your out of pocket expense is, what your primary is, what your prescription is, if you have to see a specialist. And that's what I do. I don't gear you to one insurance company over the other because legally I cannot do that.
Right.
What I do is ask you about service. What do you need for yourself, or what do you need for you and your family?
And with that, you're looking at the particulars, which is why it's important, right, for people to know. Have a list of what medications are you taking. So that way, when they're going into the marketplace, right, these are things that you need to look at. Who's your doctor? You know, what hospitals do you like to go to? Or my preferred hospital is Westchester Medical. So anything that I do, I'm going to try to make sure that I have doctors that I can go to, or that I can go there, and who I need is going to be in that network. Whereas my cardiologist, Joe Hackworth, is not in that network. So I know that I need to be sure that I can also go see him when I'm choosing an insurance. And so I just kind of wanted to bring that up because a lot of times people aren't realizing that this isn't work where they're saying you have A and you have B, right? So when you go into the marketplace, it can be a little intimidating.
And that's why we ask people to get a navigator, because a lot of times they end up trying to do it themselves, and then something may happen, they may get kicked out, they may forget something, and we're here to help them navigate that process. I got kicked out the other day. I was helping a lady and her 2 children, and we got kicked out, and I had to call, and then we lost the call. So I had, lucky for us, we had the ID number, so when we called back, we didn't have to start all over. See, these are the things that we do to help people, because it's so much information being shared with the consumer as they're trying to enroll and forget something, and it's okay. But if you have that extra ear while you're doing the work, then that way you know. And I'll say when they're on the phone, we need to write this down. I don't say you need to write it down. I say we need to write it down. And that way, if she's missed a number or he missed a number, I've got it all. And I always ask them to repeat the number. Can you repeat that, please? And just making sure that I have all the information correctly.
And so let's say I decide, I can do this myself. And some people can. There are people who go into the marketplace and successfully find the coverage that works for their budget, that works for their medication, that works for all their particular needs and their family. But let's say I go on, I make the attempt, whether it becomes too much or something happens, I get kicked out. And then I reach out to you. If I didn't write down information, is there a way for you to go in and recapture
What
where
I'm
I
able
left
to
off?
do is ask you some questions like your sign in and if you recall your password. If we can get to that component, then healthcare.gov will send them something back in an email, which will allow us to proceed. If that doesn't help it happen, what we'll do is call them.
Okay, so I won't be, so if I made an attempt, didn't, because everybody is not going to, we
Right.
all should, what we
Yes.
should and what we do are different. So everybody may not write down that pertinent information, but it doesn't mean that I'm going to be lost once I decide I'm going to reach out to a navigator. It might make it a little bit difficult, it might slow the process down, but you can find where I left off and even maybe backtrack a little bit if I need to go back. And basically, you can get in there and work with me and fix it, right?
Right.
I want to mention this too. I want to make sure we get to, you have an event coming up, the HRS Erase Navigators Open Enrollment for the Marketplace, which is going to be December 11th, 12th. Well, let me slow that down. Friday, December the 11th from 9 a.m. to 5 p.m. Saturday, December the 12th from 10 a.m. to 5 p.m. and Sunday, December 13th from 11 a.m. to 3 p.m. at Truth and Destiny Church. at 2645 West North Bend Road. What is that? What is that going to be about? What's happening?
We're going to enroll people. I could not be in the open enrollment season and not be out in the community and able to help people that probably would like some one-on-one help. We will be social distancing. We will be wearing our masks, but we will be there to answer questions that people have and assist them with getting enrolled.
I'm glad you said something, because for this event, which is something that you really, if you need to get enrolled, look, don't wait till the last minute and now you're rushing and then maybe you end up with something that doesn't really work for you or your family and you're paying more money than you should, or you didn't get one that should have been, that maybe you should have been paying a little bit more so that your deductible was less. This is coming up in a few weeks that you can go get it taken care of, it's done, forget about it, right? But you said something that I think is a good question, especially in this climate we're in with COVID, and especially the people who are COVID deniers or don't see the deal. So I show up to this event on Friday, December 11th. I'm first in line at 9 a.m., but I refuse to wear a mask.
We're going to ask you to put on a mask.
But I refuse to wear a mask.
We're in someone else's house, and we've got to respect their rules. And I just say for that time, you'll need to wear a mask.
Okay. And after you're done, go back outside, you can take it off and never wear a mask again. But at the event, not just for everyone else's safety, but for their own safety.
Yeah, and the safety of this church, who's opened up their doors to us, and they asked us certain things we abide by because of the church's rules, regulations, policies, and procedures. And I said we will adhere to them.
And that's important. And it's important to even think about, for the fact of this, you may not, and there are people who don't want to wear a mask. I have people in my family that just refuse to wear a mask. And if that's where you are, that's your choice. But just to really think about, don't pass up getting the health care that you need for wearing this covering for a few minutes or an hour. Believe me, I don't want to wear this right now, but I'd rather be safe than sorry. Not just for me, but for the people that I love, the people that I care about, and people that I don't know but I might run into. So you're coming in. It's not just you. You have a lot of navigators there, right?
Well, I'm going to ask 2 other people to come if they are available. And like I said, we will be social distancing, and we will only take so many people in at a time. So we do have the connector, so you can call and make an appointment.
What is the connector?
The connector is that tool that Enroll America invested in, and it still exists today. And so, of course, I made that phone call, and it was somebody previously from Enroll America. And so we have got it in place so we can go in and schedule your appointment.
So basically, listen, you need to make an appointment, right? Because are you doing walk-ins?
We will do walk-ins. Okay. You know, we don't want to turn anybody away. It is necessary for folks to be doing preventive care. And we need to be supportive of one another and assist them with that, so they don't have any reasons to say, well, I don't have. This is an opportunity to have. And you can reach us. This is a new number, so I don't know it by heart, so I had to get the card. It's 855-894-2711. I'm going to repeat that again. 855-894-2711. You can give us a call 7 days a week. We're not there 7 days a week, but you can leave a message, and we will follow up with you. I enrolled somebody on Sunday. Sunday is not my work day, but I accommodated the customer so he could get his needs met. We will do that. And
when you, 2 things. One, the call is free. I'm stuck on the commercials that are running, so I'm kind of taking some of the stuff. But the call is free. And then the other thing, just so that there's no confusion, because you said take care of the customer, there's no fee
No,
for getting the help.
not with us.
Right. There's a fee for getting the insurance,
Yes.
but that's not something that's paid to erase or any navigator. No navigators
Or our sisters.
or what? Or
Assisters.
sisters. Navigators or sisters are charging you. If you go to someone who's a navigator or a sister and they say a sister, not a sister, I'm sorry, and they say it's going to cost X amount of dollars, you need to first get away from them, and then you probably need to report it because there should be no fee for that.
Our services are free. We are not agents or brokers, and we are here to help and assist, and there is no pressuring. It is your decision at the end of the day.
And so there's no connection to any insurance company that you need to send people to. You're not
No.
trying to meet a quota.
No.
You're not trying to get your, I was going to say pension, but it wouldn't be a pension. You're
A
not trying
bonus.
to get your bonus
No.
or anything. This is strictly help to make sure that you can get enrolled in health care. And not just getting enrolled, because getting enrolled is one of the process, but a more important or a big important part of that process is getting enrolled with the health care that works.
Yes.
And I keep saying that, I know, but it's important that you get health care that works right for you and your family and your pocket. Because if it's too much for you and you get halfway through and it's like, I really can't afford to keep doing this, then you're going to let it go and then you're not going to have health care. So you want to make sure it's good for you, for your family, for your pockets, right?
You can't say it any better than that.
So as we get, because I don't want to run out of time,
Okay.
I want to make sure that you have some things that you want to just say, get it out there, let people know.
Know that we are here to help, and we want to help. Know that even if it's not during our regular work hours, we can make arrangements. I know that I do, and I will. Know that we want you to be insured so that you can be here for your family. I think health insurance tells you that you love one another.
I like that. Wow, health insurance says, I love you. Covering my family is just another step of saying that I love you, but covering myself for my family is another way of saying I love you enough that I'm going to do whatever I can to make sure I can not just be around,
Right.
but be healthy and be around.
And I just want to add one more thing. If you, as the provider to your family, has to go in the marketplace and the income doesn't validate the children going into the marketplace, they will go into CHIP. So everything works out for the good. So understand we will work with you and assist you as best we possibly can, and we hope that you will get in contact with us. I look forward to hearing from folks. I talk to them just like I'm talking to you, Jackie, and to develop some telephone friendships, just talking to folks and just helping them, and I'm excited about the work that we're doing.
And I want to say, I don't know how many assisters or navigators are still around from when I worked with Enroll America, but I worked very, very close with Marjorie. We worked not only in the city, we were in Columbus and Cleveland and Dayton and just working together. And what I can say that I know is that her passion and compassion for helping people and not just helping you, but educating you as you go along is very good, is very sincere. So if you get an opportunity, and this isn't a knock against any other assister or navigator, because I worked with a lot of fantastic assisters and navigators, but Marjorie is the one that's in front of me right now, and I want to just talk about her for a second, because if you need someone and you can get in touch with her, you need to call her office, get anybody you can to get enrolled, but if you're able to get with her and sit down, I'm telling you, what you may not already know, you may not, everybody's not versed on this. She's not only going to help make sure that you are able to get what you're looking for, she's going to help make sure that when you leave, that you have some education. The Bible says, my people perish for lack of knowledge. One thing I love about this sister is that she's going to make sure that you have some knowledge to go with your health care. So I just wanted to say that. I know you didn't ask me to, and then you're looking at me like, why you do that? But I did that because the Bible says give honor where honor's due.
Thank you.
And I've worked with you long enough.
So, and I want to say that I've reached out to some people that are previously from our old team. I've talked to Marissa, I've talked to Nicole, and you know I speak with Angela periodically. So all of us that were on the team together, they are good people, and when good people are brought together in such a great environment, that connection stays no matter if we do go our separate ways. So I have to say, OHIO was a good team. That's the Ohio team for Enroll America, and that's a shout out to them.
And you're right, those were some awesome, awesome people. And it's Ohio, so you know, I mean, what can I say?
We were good.
We were blessed.
Yes, we were.
We were blessed to be good,
Mm-hmm.
and that's all to His glory. And Marjorie, again, I want to thank you for coming out. Oh, when is open enrollment? When does it close?
It closes at midnight, December the 15th.
So it is close.
Yes, it really is close. We've gone into a couple of weeks, and we have been enrolling almost every day. And if something happens, we reschedule people. We don't say, this is it, and we can't enroll you. We will accommodate your needs and your time.
All right. So December, so let's just keep this in mind. I'm going to go in order here. December 7th, open enrollment for Medicare ends December, is that at midnight, December 7th?
I believe so.
Possibly midnight. It ends December 7th, and that's the part that you need to know. Open enrollment for the marketplace ends on December 15th, midnight. Don't be calling at 1:15. Talking about I need to get enrolled, right? Midnight, it ends. Don't wait. I'm just saying this, and obviously do what you like. Don't wait till December 14th at 9 o'clock p.m. to decide that you need to get enrolled. You've got time. Today is the 19th. Mm-hmm. You've got time to get enrolled. Come to the marketplace, to the open enrollment for the marketplace 2021, for the 2021 marketplace coverage. Again, that's going to be at Truth and Destiny Church, Destiny Church at 2645 North Bend Road, that's Cincinnati, Ohio, 45239, December 11th, 9 a.m. to 5 p.m., December 12th, that's Saturday, December 12th, 10 a.m. to 5 p.m., and Sunday, December 13th, 11 a.m. to 3 p.m., and you can reach out to HRS navigators before then. Marjorie, again, thank you very much for coming on. Always love when you show up. Listen, everybody, this is serious business. We're dealing with a virus that no one, I know they're saying, hey, we got the vaccine and it's working 95% because we did a test trial on a number. So it worked for 95% of that number. We don't know what it's going to do going out, but one thing's for sure, they're saying it's going to be free. But in the meantime, you've got to also shore up yourself with insurance in case you do get sick. Nobody wants you to get sick. I don't. I know your loved ones don't. Not like to think that you don't either. But sometimes we do, whether it's COVID, whether it's heart disease, whether it's diabetes, whether it's a stroke, whatever it is. And when that happens, you've got to see a doctor. So make sure you have health care. So until the next time we talk, stay faithful. Stay healthy.